Hi Girl Gang, it's Dr. Joy here and you are watching Delivering Joy MD. This is part of our Well Woman Wednesdays. We are talking about period problems. We're continuing our conversation on this. Today we're talking about the M in our PALM-COAN acronym. And the M stands for malignancy or cancer. So if you've been having period problems, stay tuned for these important details. All right, Girl Gang. So the M in our PALM-COAN acronym stands for malignancy. And so today I want to kind of hit some of the important things that you should know if you're having abnormal bleeding. Number one is always investigate abnormal uterine bleeding. And by investigation, I mean we should be doing a pap smear if you're over the age of 21 and don't have a current up-to-date pap smear. This looks for cervical cancer, and the pap test is the best way for determining whether or not women have abnormal cervical cells, which can cause irregular bleeding between periods, bleeding after intercourse, and sometimes just random intermittent spotting. So a pap test with cultures for cervical infection is definitely the way to go if you're having really irregular bleeding after you've had sex, or if you're noticing that you're having irregular bleeding after exercise. These are all things that may point to problems with the cervix, which could be precancerous cells or even infection. Another part of our investigation for abnormal bleeding is the transvaginal ultrasound, which we've hit up several times in this series. And this transvaginal ultrasound helps us to see if there are any abnormalities with the uterus, cervix, or fallopian tubes and ovaries. And so that kind of gives us an idea for women who are having abnormal bleeding as to whether or not we think this is a hormonal problem, like polycystic ovarian syndrome, where we see multiple small cysts on the ovaries, or if we think it may be a problem with the lining of the uterus or the endometrial lining. We can see that lining be thickened or have polyps on ultrasound. We also should be doing an endometrial biopsy if we think there is abnormal endometrial lining present. So if the lining looks very thick or if it looks disorganized on ultrasound, we should do an endometrial biopsy, especially if you're over the age of 35 or if you have morbid obesity. These are risk factors for endometrial cancer. There are also some cancers that run in families that can happen in the lining of the uterus. Investigation can also include a pelvic examination. And a pelvic examination is when we place a speculum into the vagina to look at the cervix and the surrounding vaginal areas. In addition, we may do what's called a bimanual examination, where we use a finger or two to feel the cervix, to examine the size and shape of the uterus by pressing down with an outer hand. And we also are able to get some information as to whether or not there are any lesions inside the vagina or on the cervix. The take-home point here is that before we start any treatment, we should fully investigate the source of your abnormal bleeding, because malignancy can certainly occur. About 7 women out of per 100,000 women will have cervical cancer in the United States. Thanks to the pap test, we're able to diagnose this early, usually before cancer occurs, and we're able to fix this. Cervical cancer used to actually be one of the #1 cancer killers among women prior to the pap test becoming popular about 40 to 50 years ago. So making sure that your pap smear is up to date and that you have been screened for cervical cancer is absolutely important. So if you haven't done your annual exam, make your appointment today. In addition, uterine cancer can occur. So when we're thinking about uterine cancer, the most common causes are unopposed estrogen use. So women who are postmenopausal, who've been getting estrogen replacement without progesterone, if you have a uterus, should certainly go in to be seen and examined by a gynecologist. All women who have a uterus and are opting to have hormone replacement therapy should also have progesterone, whether that be in the form of a pill or a IUD or even a topical solution. Progesterone is absolutely key to protect against uterine cancer in postmenopausal women who are undergoing hormone replacement therapy. Also, women who have morbid obesity are at higher risk of having thickened lining of the uterus, and that can cause abnormal bleeding. And this is what we call proliferative endometrium. The problem with proliferative endometrium is that it can lead to cancer. And that is because the lining of the uterus is constantly making copies of itself. And eventually one of those copies is a dud. And you can have abnormal cells that are growing on the lining of the uterus that can eventually become cancer. So if you're having really heavy periods and you're over the age of 35, or you have morbid obesity where your body mass index is over 35 to 40, or if you've had a history of polycystic ovarian syndrome in the past, and you're having irregular bleeding, these are very important clues that we may have a problem with the lining of the uterus. So we should do what's called an endometrial biopsy, where we use a small catheter to pull some of the cells from the lining of the uterus. The catheter is placed vaginally through the cervix, and this is a procedure that can be done in the office. Most women complain that this feels more like menstrual cramps than anything, but it takes a very short amount of time to do and can be life-saving. The reason that we're talking about malignancy and abnormal uterine bleeding is because most of the time malignancy is preventable, whether we're talking about cervical cancer or endometrial cancer, which affects about 24 out of 100,000 women. We are talking about cancers that are largely preventable or curable if they're caught early. So it is vitally important that you are talking with your healthcare provider about abnormal uterine bleeding if you have it, and that you're continuing to have this conversation if you find that one healthcare provider is not interested. It's very important to continue talking until you have someone who is able to help you investigate abnormal bleeding and find a cause for it prior to putting you on treatment. I really highly recommend that you explore causes of abnormal uterine bleeding prior to starting any treatment, because we want to rule out malignancy. Subscribe right here so you don't miss a single episode of Well Woman Wednesdays. And if you have questions or comments about abnormal uterine bleeding, please post them in the comments section below. If you've got a topic that you want me to cover in this series, post that below as well. And we'll catch you next video. I hope you're having a wonderful holiday. Peace.